Great. I think we will go ahead and get started. And Allie, if you can keep letting folks in, I see we still have a number of people joining us. But thank you so much, everyone, for joining. We have a wonderful speaker today, and we're glad you're here on your lunch break. I have a couple introductory remarks to get through before turning it over to Gina Green-Harris. Primarily, I wanted to share with you, advance my slides here. If you were not already aware, this is the first of a 5-part workshop series on verbal communication with study participants. I hope you can join us for the other sessions as well. All the speakers are sort of showing up with different lenses on this idea of verbal communication and the art of communication and different perspectives on it. So I think all of these sessions will be very meaningful and applicable to anyone who works with study participants. We are going to put the registration link in the Zoom chat so you can sign up for more sessions if you have not already done so. And then just a tiny quick self-promotion here. I did want to share that the workshop series is hosted by the Recruitment and Retention Resource Center, the RRRC, here at the Institute for Clinical and Translational Research at UW. And we are here to support you in any recruitment and retention work you are doing. And we can provide the services shown here, and we're also happy to consult with you. There's no cost for that service. You can also email us at the email address shown there if you have any sort of one-off quick questions, or you can request a consultation, and we'll put that link in the Zoom chat as well. And we would love to help you recruit and retain your participants. And just a couple housekeeping notes. Number one, firstly, we are glad you are here. Thank you again for joining us. Gina encourages questions, so feel free to at any time chime in with questions or comments. You can also post those in the Zoom chat if you're more comfortable doing it that way. We are, as you saw when you joined, we're recording the session, and we will share out a link to the recording afterwards, along with a summary of the Q&A and a very short evaluation survey. If you could just ensure that any questions or comments that you contribute do not contain any confidential information or anything that might identify study participants. And then finally, if you come away with any questions about what you can or cannot say to study participants, we would recommend that you reach out to your IRB reviewer to discuss that. And I'm going to turn it over to Allie, who is going to introduce our speaker for the day.
Okay, hello everyone. We are really excited to have our Gina Green-Harris as our first speaker for this session. So a little bit quickly about Gina. She's the director of the Center for Community Engagement and Health Partnerships in Milwaukee, the Wisconsin Alzheimer's Institute Regional Milwaukee, and the co-director of the Just Research Program. As a director and emerging health equity scientist, she builds and leads collaborative partnerships with researchers, institutions, and programs across UW, the state, and the country to advance health equity research in ethnically diverse populations using asset-based community participatory methods. In addition, Gina is a fourth-year PhD student in the ICTR graduate program in clinical investigation and translational research. Her training has helped her build researchers' capacity to engage effectively with advisory boards and develop strong partnerships with lay stakeholders in research. She also has extensive experience training and guiding researchers on how to effectively engage with community partners to successfully conduct equitable research within communities. So thank you, Gina. We are so excited to have you, and we will turn it on over to you.
Well, thank you so much for having me. Good morning, everyone. Can you hear me okay? All right, I'm going to go ahead and share my screen, and we're going to go ahead and get started with our presentation. First, can you guys see my slides okay? Oh, no, you can't because I haven't shared them yet. Whoops, there we go. Gotta love technology. There you go. I just told you something about me, right? This is not my strong suit. But anywho, I am excited to be here today. I thank you for the invitation. Don't take it lightly. I want to give you guys a disclaimer that this is probably not going to be the presentation that you normally would have around just a bunch of clinical kinds of language and just the straightforward talk, because that's just not who I am. But I will promise you this: you will walk away with some tools that you can use and hopefully some new excitement around working with our community and your participants during research. So, and for other reasons as well. So with that, I'll go ahead and get started. And I will share, and I will say from beginning. We will do slideshow from beginning. How's that? And you still back at here. Okay, guess what, guys? Let's see. How's that?
We got
Looks
it.
good.
There you go. See,
Perfect.
here we
Teamwork.
go. Now let me reintroduce myself. I am Gina, the person who has no knowledge of IT skills, but I make it work and usually always have some help. So thank you guys. Woo woo, give yourselves a round of applause. So here we are. We're just going to move forward. I appreciate everybody's help. Thank you so much. This is called humility. This is the first step of 10 steps of understanding how to work with community. Be flexible, be willing to have humility, and actually bring a little humor with you, because guess what? You never know what you're going to be up against. So that's number one. So reality is, I just want to talk briefly a little bit starting about attitude is a little thing that makes a big difference. And again, when you think about this, just now was a great example for me, because I could have been all edgy, I could have been all nervous, which I was nervous, but I could have been really kind of, taking off my A game. The fact of the matter is that we don't get to control much in the community, right? We do not get to control things that happen, and things happen beyond our control, beyond our comfort zone. I am totally accepting that I'm uncomfortable with IT challenges, but at the end of the day, if I am open enough, and if we're open enough in this conversation, people were willing to help me. I was not embarrassed by it too much, right? But I took it in stride. That is really important. How we present, what we present makes the biggest difference. I always say, the want you to remember, if you don't remember anything else I say today, is you only get one chance to introduce yourself to people. The first impression is the lasting impression. Had I been cantankerous, had I been cranky, had I been like really nasty about what happened, you guys would have probably all jumped off and be like, why are we even on that call? Or you would have, that's what you would remember about me from here on out. Have you ever introduced yourself to someone or been introduced to people, and they come off and they put you off in a certain way? And then the next time it's like you meet them, you're kind of hesitant because you're not sure how they're going to be. You have to remember your attitude is a little thing that makes a really big difference in how we communicate when our first meeting and our second meeting. And how many times have you made a mistake when you introduced yourself or you presented yourself and you weren't the nicest person, or you just weren't on your A game, and all of a sudden you see the same people again, and then guess what? They're remembering how you were and you're trying to be someone or something else. You have to make sure, and it's okay to say, hey, I blew it, I made a mistake, or just acknowledging that I was off my game that day. Attitude is very important. And then the other thing I'll just say about attitude, how we perceive the work that we're doing is very important. If we think about the work as helping, changing, making new benefit to people, long lasting, sustainable, we will have a much different attitude unless from thinking that, oh, this is just about the grant. This is just about bean counting. This is just about, no, we have to have the right attitude all the way around, and be smart, be brave enough. I said smart enough, but brave enough to start a conversation that matters. Now, I just want you to take for a minute when I think about this first screen about conversations that matter. The conversation that matters is the one that matters to the people who are in the room. So, for example, you may be coming to talk about your research study around Alzheimer's or around eye disease or around kidney or heart or diabetes, but is that really the conversation that matters in the room? Be brave enough to come into the room and talk about a conversation that may have nothing to do with your research. Oftentimes, as I said, how we introduce ourselves is how people remember us. Sometimes my conversation when I go to places in community or at work, or even just thinking about even an email, believe it or not, I start my conversation by being really collegial, very open, very welcoming, saying, hey, how's your week starting? Happy Monday, happy Friday. Now, some of you guys say, but is that a conversation that matters? For someone on the other end who had a horrible weekend, or who's got, a day that started with no sunshine, it could be a very good conversation, way to start your conversation. Thinking about the end user is a way to start really excellent conversations. And so I want us to think about that in the context of the 10 kind of steps we're going to go through today, and the conversation that we're going to have today. I want you to really step back and just kind of take some breaths about who you are, about why you're here, and what did you come to hear. Now, I will tell you this, I will talk about some of the common things we hear, but what I want you to do is think about personalizing those for your own benefit, for your own sake, and really be introspective today and think about, who am I in this role of a healthy conversation? So who is Gina and why am I even here today? And so you will see on this slide, you'll see in that back water splash is a picture of my grandmother. And that's my grandmother, her name was Myrtle Campbell. And she's my reason for being. She's everything that, I want to be in a person. My grandmother passed away, unfortunately, when I was 16. But prior to her death, she really was my shero. She made me believe in myself when I didn't even know who I was. And so here's some principles that I practice every day. And it's about a catalyst for change. My grandmother believed in change. And what she did to prove herself to us as a family that we could change is that at an age after she raised her daughters, she went back to college and became our first college graduate in our family. And what she did was left a legacy for her grandchildren, great grandchildren, and so on and so forth, to believe in education and to always give back to community. And so I could talk more about her, but I only have a little bit of time. But I just want you to know, having a reason why you do what you do and being willing to be open about that before you start talking about your work is really important. So if I were to ask you 3 things about me right now, I bet you could name them. And I've not even talked about what I do at my job, which is really important, because the number one thing about this, and Erin Bailey's on this call and she'll appreciate that, this, what I'm getting ready to say, is that at the end of the day, we're all human first. We are all human first, because if you're human and I'm human, some of that other stuff, it really doesn't matter, because at the end of the day, you've got to find connectivity, and and humanism is one of those ways of doing that. So I want to say that today's conversation is really born out of my work that I've been doing about From Promises to Practice, bi-directional engagement, communication, and with our Just Research program, along with my other programs that I lead, which is about meeting people where they are. And I won't go through all of these for sake of time, but I will highlight always having a personal mission and vision is really important when you're getting ready to engage the community, whether it's about research, whether it's about a research study you're thinking about, or if you're in the middle of one, you're just starting one, when you're thinking about how that budget's going to look, you have to really understand what's your personal mission and vision for the work that you're just about to do as you're getting ready to engage community. Because believe it or not, I know many of us don't think about it sometimes, but how we perceive our work, how we perceive who we are, and the reasons why we're doing our work often will funnel and really drive how we develop our research studies, how we develop our budgets, and how we decide who's going to work in our programs, and how we're going to volunteer our times for community, if that's something we decide to do. That is really important. And then the last thing that I want you to think about on here, which we'll go through some of these in different slides, but I want you to think about your sustainability plan. Before you go into the community and before you start talking to the community about research, have a sustainability plan. What's going to happen before at the end of the grant? You need to know before it ends, before you start, how are we going to make sure that the community that we enter in is going to have sustainability, and or the programs that we start, or the grants that we do, or whatever the research that we do is going to have lasting effect in our community. Why? Because when you start talking to research participants about your study, that's on their minds, and that should be on your mind. If someone is to ask you, so I know that there's no, the comment is always, what's in it for the participant? And we say, oh, nothing, just goodwill, right? We're going to do long-term research. We're going to make sure that, we know more data. Well, what happens after the study ends? We have to have really good answers for community. And those answers may not be there's a cure on the end of it, but the answer that you have to have is something that's going to be relative to go back into the community. And we have to be able to have a soft touch in that conversation and being ready to explain to the community how research works. If you're going to do a clinical trial, if you're going to do some type of study in the community that involves taking blood, vital signs, or even just a survey, we need to have clear language of how we're explaining that to people in a way that they can understand it, which I'll go through here shortly. Now, I've been talking a lot. I know I only have a very limited amount of time, so I do want to give a quick kind of commercial to say if you have questions, thoughts, or comments, please put them in the chat. I'm happy to answer them. This workshop really is about making sure you get what you need, as well as I'm making sure that I do what I say I'm going to do. So why do we have to talk about communication? Communication is complicated, and there's so many ways to describe communication. There's so many ways to do it. I love this piece of data, or this picture, because it talks about the synonyms for communication, right? And we always think it's just this linear kind of thing. It's me talking to you. Well, communication means so many different things to different people, right? So it could be about giving advice. It's about advisement. It's about announcing. It's articulation for some people, right? Conversation, converse, all these ways in which we're describing communications. And depending on the audience, we really have to get the communication right. And we really have to think about it. Communication can be verbal. Communication is oftentimes written. How many of us know that communication is through our virtual world now, right? We're all communicating virtually. And so we're speaking more with our hands, with our body language, what you say, what you don't say, how people think about you, how they look at you. All of that is in communication. Now, I won't ask this question, and thankfully you guys know I can't see you, but how many of you know if you have a poker face or not? If you've got a good poker face, well, bless you. I don't have a good poker face. I typically am the person who tells everything through her face. So I'm working on my communication style. Why is that important when talking to participants or talking to community? Because if I've got a frown on my face while they're telling me their stories, what kind of communication and messaging am I giving? So our delivery is so important on many ways and many fronts. And so we have to think about that. And then communication is also translating information back from the participant, right? So not only, which we'll talk about, not only are you speaking, but they're speaking. What are you hearing? What are you experiencing through that communication? So it's really important that we talk about communication, because communication can be very complicated. So I decided to think about this in my MBA hat. For some of you who don't know, I have a Master's of Business Administration, and I think about communications. And I wanted to make everybody in the slides, the workshop, feel good to know that communication is something business people can't do either, and that's what they're paid to do. So don't feel bad about it. We just gonna work through it. But research shows that only 6% of communication executives, leaders, feel confident about their ability to manage declining levels of employee engagement. Now we can translate this to talk about our community, our communications with our research participants, right? How many times have we thought about, we just can't get folks engaged? But we know the key to engagement is really developing our communication skills to empower folks, to make sure folks feel comfortable where they are. So here's a really interesting little picture here. I just love this picture. It's not about you and it's not about them. Does anybody know who said that and what movie that's from? Anybody think they know? I can't see you, so I have no idea if you're raising your hand or not. So I won't pretend like I can. But if you know anything about this, does anybody know? I can't see. And somebody tell me if somebody's got their hand up. Do anybody know who might have said this? Nope. It was Clint Eastwood. And I believe it was in the movie Make My Day or something. But here's the deal. I always think about this because it's not about you, it's about them. We always say that. But my dad is really funny because my dad thinks Clint Eastwood is who I happen to really like. I like Clint Eastwood and I love his movies. Well, my dad calls him a fake. He's a fake cowboy. And in my dad's mind, the best cowboy on earth is Billy the Kid and Jesse James. And then he loves them, right? And so he's like, Clint Eastwood, he's an imposter. But why is that important? Because when I'm talking to my dad and I'm like bragging on some of these newer movies, he's like, no, you don't get it. So I have to listen to what my dad is saying and recognize that when I want to have him, because I have to help him out with his television and me TV is his friend. And so when I am helping him, it's not about me wanting to watch Clint Eastwood. It's about him really wanting to find Jesse James and Billy the Kid. And by the way, he thinks Billy the Kid is the Mac and Jesse James can't be out Jesse. So we have to work on that as well. Now, it's about how his position is, his thought patterns are. And the same with our community folk. It's not always about us. It's really about what they're thinking, what's their mindset, and where are they coming from. They're not always coming from what is important about our research. They're not always coming to us to think about what our next study is. They're trying to understand probably, first of all, what is research? Why should I join your research study? I don't even know you. And so we have to remember that we spend hours upon hours with our studies, with our research, with our education about research, and our community doesn't. So our role is to make sure that we're helping people, changing lives, and really understand that we are articulating our priority is not always about enrollment and numbers. It really is about change and help and helping the community to be better, to have risk reduction, to have health disparity reduction, right? And move from health disparities to health equities and understand what that looks like from a perspective of the community. Health equity can look very different to the community than it does to us through our research. So those are things that we really need to think about. All right, so here's a study that Dr. Passmore, Sue Passmore and I did together, and it's called There's Not Much to Do, We Can Do. And so why is this an important slide? Because as I just shared with you earlier, community leaders and business thought leaders are uncomfortable with communication, as well as our own researchers. This was a study that was done on our UW campus, and it really talked to our principal investigators, research staff about why are we having these barriers in inclusion of underrepresented population? Well, some of the comments, and this first comment was from an actual, you can't see it on here. I think I made the slide too big, but it was from a PI. And it says, I still mostly feel like I don't know the right way to do this. And yeah, there's a lot of anxiety or doubt. But I want you to see this slide and think about the fact that we all have anxiety, we all have doubt. But the first thing to remember is that it's not about us. It really is about us stepping back, acknowledging our doubt, acknowledging our level of uncomfortability, but then recognizing that we're all human. And that if we go from the perspective of thinking that we can talk to people as humans versus thinking of talking to people about our research, our recruitment all the time, we can maybe reduce some of those anxieties. And then figuring out what are those right approaches. I do want to stop here and put a pin in this to say, I want you to be clear, there is no exact right way to do it. The right way to do it is to try. The right way to do it is to do it with real authenticity, recognizing that, guess what, folks? Everybody makes mistakes. Believe it or not, I too make mistakes. I know that's hard to believe, but I too make mistakes. We all do. And we're not always going to get it right. But the point is, if you get it right for the moment in which you're living, that's the best you could do at that time. And then you have to realize that that's a normal process. So what are the 7 C's of communication, right? You see all those wonderful smiles on those people, right? So there's communication. Clearly, they're excited to be wherever they are, and that's actually a picture from the Amazing Grace chorus. And those are folks who are living with and their caregivers who are on the Alzheimer's journey. But here's some of the 7 C's of communication that you may have already heard, right? And I intentionally took them from, like I said, my business hat. Clarity of communication, clarifying what do you want to say. Consciousness, making sure that what you say makes sense to the people to whom you're talking. Concreteness, we often talk in generalities, we often talk in these big themes, but if we can have concrete conversations and correctness with people, correctness can mean obviously we want to get our facts correct, but we also want to make sure that when we're speaking in correctness, is that it is really meeting people where they are, that this level of correctness that we're using is what is that community's need at the time, right? Coherence, making sure what we're saying is clear to the community in the way in which they can receive it and accept it and understand what we're doing. Now we use, and we always talk about not using jargon. I've got some things in here real quickly that I'm going to share. Completeness, completing what we're saying, completely filling our thoughts out, and then courtesy, always showing courtesy for the people who are in our conversation. We often talk about relating our research when we are talking about these 7 C's of communication. For me, I think about making sure as we're talking to people that our research relates to these people. So for example, if I'm talking about cell membrane, for example, right, which I never will be talking about, but if I am talking about cell membrane and the structure of the cell membrane wall, guess what? I can talk about and relate that to folks who to discuss the walls in your house, right? Walls are designed to create structure in a home. I can translate that from talking about these cell membranes to something that is concrete that people can think about in their context of their real world. We oftentimes talk from our vantage point of acknowledging what we know, but we really want to get down and learn the language of the people and connect with them where they are. So we also want to make sure in these 7 C's of communication that what we're talking about is relevant to the community. So for example, if we're talking about computer glitches, all right, everybody's doing the technology thing. How many of us know our computers glitch, right? Well, if we understand glitches, we could be talking about, for example, how can we use an example of glitches to describe what happens sometimes in the brain as it relates to Alzheimer's and dementia? That is something that we can relate, it's relative, and we can explain. And guess what? Most folks will know what you're talking about. We can also talk about cell phone towers, right? People know when you're driving out of out of the network, right? Well, you can no longer hear or communicate. We can use network in a way to describe some of the science that we're doing, some of the research that we're doing, so that folks can understand, oh, I get that. And that's a great communication. Now, let me be clear. It doesn't only mean that you understand the science, but it also means to the community that you're human. Oh, I understand cell phones. You understand cell phones. And let me be clear, when you start talking about cell phones, people might say, oh, so do you have T-Mobile? I hate T-Mobile. Do you have Sprint? Oh, Sprint's gone. That's right. It will engage these new conversations that are also relative to the work in which you're doing, right? And it will help you as you're driving these relationships that we're trying to build with community. So I also just wanted to throw this in here, thinking about motivation of how we think versus community. Oftentimes there's the difference between this intrinsic and extrinsic motivation. When you and I go in community, sometimes we're at the point of having this extrinsic type of motivation, meaning that we're looking for, we have these external things that are going to happen, our career growth, right? We're thinking about writing papers, and we're going in the community having to feel this grant responsibility, making sure that I'm doing what I'm supposed to do, while the community is coming to the table for real reasons of, hey, I'm curious about this research. What can I do to help? How is this going to help me inertly? What's going to happen to my family? It's really internal, and it's really something that means something of value internally to them. So I'm not saying that our research is not internal to us, but we oftentimes have these yin and yang kinds of ways of presenting ourselves to community, which means that when we're having conversation with community, we're on two different levels. So the only point about this is what I want you to take away is make sure that as you're entering the community and you're talking to researcher participants, that you're on the same level, that you guys are really meeting in the middle, and that it really is a conversation on the same level with the same type of understanding and reaching the same goal, that both of you are actually having the same goal for the conversation. And then, of course, when we think about our emotional intelligence, and this is just in here to think about when we're engaging community, we want to make sure that we're practicing emotional intelligence, because oftentimes, again, we know what this is, but I wanted to really focus on motivation and social skills, understanding that our way and how we indulge ourselves with communities, especially communities we're uncomfortable with or don't have a lot of knowledge of. We have to practice our social skills. We have to sometimes go into the community and just sit. We go to the community and listen. And listening means listening for the point of understanding, listening for the point of not just responding, but really melding and resonating with what the community is trying to say, and thinking about that, and then having open, honest conversations with community is really important. And what I mean by that is meeting people where they are in your conversation. So if I want to talk about sugar and diabetes, you have to know what I'm talking about. And then your social skills have to come into play so you can listen and then not say, oh, Gina, you mean diabetes? Because I'm saying sugar, sugar, sugar. And it's really not what you're used to using, or I'm using a language that you're not used to. It is okay to say, well, I'm not sure what you mean by that. Can you explain that further? Does that make sense to everybody? And I just want you guys to know, I'm just going to do a real truth telling here. I like to see people, and I cannot see you guys. So I don't know how you're feeling about this. So I might have to stop sharing my screen just to get a little help over here. So if you guys are getting something out of this, I need you to hit a thumbs up or tell somebody, say something. This is what you really need. I don't know. I'm a little like, but it's all good. That's just who Gina is. So I want to head back to just quickly, because we often talk about bias, assumptions, and discomfort. I'm not going to stay here long, but I do want to acknowledge that when we're going in community, it's really important to let our biases be known to ourselves, to our teams, and sometimes to our community members. And what I mean by that is acknowledging that I'm uncomfortable in this space. It is so okay to acknowledge discomfort. Now, it's not okay to stay in that space and keep acknowledging, but it is important for us to acknowledge, what do we think? And then if these are your biases, before you head out to that community, check them out to see if they're true. Is it true that jobs won't let me take off work because I'm African American? Now, is that really true? Or I have to take a bus everywhere? Figure that out for yourself. That's a thought, and that's a thought based on media. It's a thought sometimes based on what we believe is lived experience, what we've been told, what we've seen. But is it all African Americans? Think about that. And so if you go into the community thinking that, oh, I'm going to have to pass out bus tickets to everybody, that may not be true. And if you put that out there, well, when you talk to our community, it may be a little offensive, because guess what? I just drove to this meeting. I did not need a bus ticket, right? So let us think about our biases, acknowledge them, and then own them, and then let's work through them. It's really important to do that. I'm not going to go through all of these for sake of time, but I just wanted to let you know that sometimes we have to acknowledge that, and all times we do. But I also want to say, we all have biases. I have biases. I have discomfort, and I make assumptions. It's not something that is not human. what is the solution, though, is to work through them, to acknowledge them, and to make a difference, and to really try to change them and be conscientious about it. Those 7 C's, being conscientious enough to say, oh, that's a bias. And then also, I will tell you this other behavior that I think is really important in communicating with community. Do not write the narrative for the community. And I shouldn't say do not, because that sounds like, hey, do not. But I want you to think about, how are you writing a narrative before you even meet people? Think about that. We do that frequently, right? How many times have you had a disagreement? I'll say with a sibling, because it happens even at my age. And I'm writing the narrative of how my sibling's going to respond. I already know what she's going to say and how she's going to respond and react. And so I'm preparing a narrative for her, for me, and I've written the whole story in my head. And then when I get there, guess what I do? I implode or I explode, and I put that narrative out there when that may not have happened had I just got there and been like, hey, I know we didn't see eye to eye. Let's talk about this, right? Those are things we have to think about. And even with our research participants, we write narratives, right? How many have written a narrative before a participant has gotten there to do a study for us? Oh, they're coming from way across town. They had to ride the bus. They're going to be tired. They don't like coming over here anyway. This is not, we've already written a narrative. Those are ways in which when they get there, we're responding and we're communicating based on our proposed narrative. And so those are things we need to really think about. And instead of writing a narrative, understand, yep, you may have come from across town. When they get there, your conversation is, hey, how was your ride? How did you get here today? Was it okay? When you woke up this morning, was it an okay day? We really have to think about that as we're communicating. So here are the real 10 communication skills, and here are the real 10 skills that people really think about when we think about effective communications. I know you guys are like, when is she going to get to those 10 things that she said we were going to learn? Well, I've been all over them, but I want you to know that here's some really important points that most people think about when we're talking about effective communication skills. And what you'll notice is that I have a few things in boxes. I did not, because of time, I can't highlight everything. And we always talk about some of these things. So we talk a lot about cultural awareness, compassion, and education, which I did not highlight, and trust. We talk about trust building, which is really important, but it is something that I want to focus on: these verbal communication, active listening. And I talked a little bit about nonverbal. I'll talk more about that. Our presentation skills are really important. How we present ourselves to people is very important, and personal connections. So when we think about these communication skills, it's really important to focus on feelings, and feelings are not focusing on, oh, that sounds so horrible. Focusing on the feelings. So making sure that you're validating experiences that people have had. Now, it doesn't mean, and I do want to say this clearly, I work very closely with a couple gentlemen who actually work with folks who had the Tuskegee experience. And when I say focusing on experiences, I'm not talking about going all the way back to what happened at Tuskegee. I'm not talking about the Mississippi appendectomies. I'm talking about in the moment validating what people are living now. I'm talking about acknowledging that as we're having conversation with people, it may be bringing up remembrance of things that just happened. So for example, if you're working with a family that is going through diabetes and a loved one just lost a limb, that is a current experience, and you may be wanting them to participate in your diabetes research study. You need to validate the experiences that they're going through and then build that rapport. And you can talk about diabetes in a whole different way. You can bring in your own personal experience, right? I know sometimes people are like, what? Yeah, do I talk about my family? Sure, you could talk, you don't have to tell the names, but I can't, this is what I tell people. Everybody has experienced something similar. May not be the same, but it's some similarities. Let's talk about those so that I can express to you, again, I am human and I understand what you're going through. I may not have diabetes, but someone in my family may have it, or it may be cancer, or it may be something else. But we can talk about why and how people are having those feelings and to establish our rapport. Speak in a calm, neutral tone. oftentimes I want to make sure that people say things and our community members say things that are oftentimes like so strong and they are so sure. Research sucks. People are not nice. Researchers only care about their numbers. They only come over here when they want to take our blood, take our whatever, right? That can cause a little rise in some people. Not everybody, and nobody on this call for sure, but it definitely can bring a rise. Remain calm, keep a neutral tone. It helps people feel safe. It helps people know that you're listening to them, but you're not taking it personal. And then your tone throughout the conversation, it cannot be, let's make sure we're not condescending. So, when we talk about, oh, I won't use any type of the communication, I will not use the jargon. Well, then we go and we talk to people like they're third graders, and they might be, or we use language that can be condescending. I won't even say third graders. It can be condescending, right? So we go from one end of the spectrum to the other. Really making sure we're not doing that is very important. Empower with choice. Make sure you give people opportunity to respond to what you're saying, having full conversation with you, making sure that you hear them and allow them that autonomy that they need to experience the conversation for themselves. That gives the respect, that gives dignity, it gives confidence, it gives the opportunity for the people who are in there listening as participants or potential participants to know that you're into them. You're really excited that they want to know more about your work. Be open. Make sure that you are able to be open enough to share where your positionality is coming from, where your beliefs are coming from. Be open to share and express your feelings so that people can express their feelings as well. Creating a safe space is so important. And then also, I want you to think about this. What are some of the needs that are not being met, right? So we come in the community and don't write the narrative, but do in the midst of coming into these spaces, think about, I know what I'm here for, but what is it that the community needs? So when we first started doing our work, when I first started doing my work in Alzheimer's disease, we came to the community and we thought, oh, we're going to talk all about dementia and Alzheimer's. The community, they had needs around heart disease, they had needs around diabetes. They had needs around understanding how to just be healthy. So we had to back up from our agenda and really focus on what the community was saying and engage them where they were. And then we were able to have these really nice conversations because what we did is that we didn't focus and push our agenda. We really stopped, stepped back, met people where they were, and listened to what they said. And then we focused on what they needed. And so we had to know what motivated them. We had to make sure we understood that we focused on what they wanted to focus on as we were learning together. And that's the other thing I do want to say. Making sure you're going to at all that you do together with the community, not for them, not in front of them, not behind them, but walking alongside, and we're communicating and working together. So how do you do this? First thing I want you to think about, and I've got about 10 minutes left, guys. So I'm going to kind of slide through these things really fast. Think about your audience. Analyze your audience. I love this slide to use this in this context because you have a multiple, again, we always think, oh, just audience broad, global. Here's how we think about our audience. We have our general audience, which is usually our research participants, right? And then we've got knowledgeable but non-experts. Those are also our participants a lot oftentimes, right? People who have gotten Dr. Internet and Dr. Med and all the Dr. Google scholars, right? Or just people who know the context of what we're doing. When we meet those audiences, there's certain things that we need to make sure we're doing. And then it's different from when our peers and our colleagues, right? We really need to make sure that we are understanding what and who our audience is. And that audience acronym, you can take that. It's analyze, understand who the demographics, the interest, the environment. Now, the environment is really important. Where you are is really important. If you're in the church, is very different than if you're on the college campus. If you are in a shop where people are having coffee, that's a very different place than if you're in a lecture hall. We really need to make sure environment is important. It's cultural. Are you in a community that doesn't feel safe after 7 p.m.? That's very different than in a community that stays out till midnight. You really, if you're in the downtown district, what does that mean? Just because it's after 7 and the Bucks game is ended, people are going home, right? So you got to make sure that there's transportation in that environment. You got to make sure that people feel comfortable being in the Deer District after a certain time. Where you are makes a really big difference. And then customize your messages. Make sure you're not just doing a cookie cutter approach where you're taking a word or two and just transitioning them out, because you can say the same thing to your peer audience, from your general audience, but does it mean and does it translate the same? Really think about how you're engaging a general audience. I think it's more than just taking out the words, the acronyms, and then going into the general audience. It really is sometimes a completely different message, because you want to make sure that that lay audience understands where you're coming from. I very seldom use jargon, but I also use a lot of context of pictures. I use really great examples. Like I said, I talk about cars, I talk about life, I talk about dogs, I talk about, because I love dogs, by the way, it's a whole nother story. But that's the other thing. Don't be afraid to veer off your agenda that you set. Make sure, if you're reading your audience correctly and you are noticing that you're not getting the ahas and the nods and the head shakes, do not be afraid to stop in the middle of your presentation and say, hey, how you guys doing? Are you getting this? Is there something that I'm asking that you're not thinking about? Is there something can I change something up? You got to be thinking at all times, because again, this is not about a one and done. This is about building lasting relationships over time. I've got the other thing about an elevator pitch, making sure your research, how you talk about your research, casual with family, friends, right? Sometimes that's our audience. Making sure it's semi-formal if you're in a scientific meeting, formal and competitive. Oftentimes we want to take our competitive and formal elevator pitch to the community. That's not necessarily the right place to have that pitch, but you want to make sure that, again, you're having these discussions like that casual discussion. But think about when you're talking to your family and your friends about your work. You're not condescending. You're not dummying it down or watering it down to the point where it feels like remedial, but you are having a conversation where you are raising the intellectual willingness and intellectual interest. Those are really important when you're talking with our future research participants or current research participants. And then I do want to talk about this with this communicating kind of with the audience and our verbal skills, right? So if I have in a phone call, we're speaking in a meeting, project your voice, but don't yell at people, right? But speak up. If I'm talking like Mickey Mouse and Minnie Mouse, you're like, who is she? What is she? It doesn't feel comfortable, right? A voice modulation is important. Monotone voices really might not go very far. Tone modulation, active listening. When you hear people sometimes talking back or asking, hear what they're saying, be able to repeat what they're saying, but most importantly, listen to learn from what they're saying. Have an appropriate amount of humor. I am a humor person because I like people to laugh, because I laugh at myself all the time. So you don't have to laugh with me, I laugh for me. And then strategic pauses. Now, I've been talking for the last 40 minutes, but normally I would have a pause because I think it gives you time to think. Strategic pauses are really important when you're working with community. We often ask community questions and we want to answer right away. Sometimes the community really is just thinking. It's not that they don't understand what we're saying, they're thinking. And I don't know about you, but I know in our world, thinking takes up time. but it's a really important key. Give people space to think, and that's where those strategic pauses come in. And then engage the group. I've asked you a couple times, hey, can you see me? Can you hear me? Because I want to make sure you're still here. Is my internet still working? Is my screen still up? I don't know, right? And I am a talk back to me. How am I doing? What are your thoughts, comments, and questions? Asking people if this resonates. Do you have an example to share? Always be ready with examples. And then tell an off-point story. Like, I talk with my hands all the time. That's off point. Who cares? But I got your attention, right? Because some of you talk with your hands. Or if I go tell a story and say, hey, I was really thinking about my grandma today, and this is really, I feel her presence with me right now. Now, somebody else, you may not connect. Not everybody will connect, but somebody will. You want to connect with all people in the audience, and you want to make sure people, again, see you beyond your research, beyond coming there asking me a question, beyond doing a presentation about your work. You really want people to recognize who you are as a person. And then I'll also say this. And one of the other things I want you guys to remember is that when you do go in the community, engage, sit with the people. And I know I'm kind of I'm really almost all out of time. Here's some nonverbal ways. Sit with the community. Really make sure that when you guys, I know sometimes we'll go in clusters of 2, 3, 4. We get to an event and we all sit and talk with each other. That's really not the way to do that. I need you to engage. Sit at a table with people you don't know. Come into the space ready to talk and meet and engage and talk about other things that matter with people outside of your research. And then I'm going to move to this final slide because I want you to see this. But in summary, I want you to think about these steps. Don't assume, ask questions, ask permission. Should I call you Miss Green Harris? Do I get to call you Gina? Hey, what do you want to hear today? What do you want to get out of this today? Ask for permission to shake my hand or hug me. Which one is it? I'm a hugger. Everybody's not. Don't know everything, even if you believe you do. Sometimes it's good to say, I really don't know about that. What might I be able to do? How can you explain that to me better? Be willing not to be the expert in that moment. When we walk in community, we're no longer, or we should not be, quite frankly, the expert of the community because we don't live there. We don't practice there. That is not our everyday environment. So allow the community to be an expert in its space. I didn't say content. I said in its space. Often something of substance that is not necessarily your scientific work or work related. Interact with grace, not arrogance. Again, sit amongst the people. Prepare a personal statement. Why are you there? Not why are you work there. Why are you there? What brought you to this juncture? And prepare a non-work introduction. As I said, I did not mention anything about my background. You know who I am, and maybe later on, as the conversation goes, we will talk a little bit about who I am, and we will then discuss. But I very seldom introduce myself as the director of, because that gives the community a very different taste than, hey, guys, I'm just Gina. It makes a very different conversation. Create a relative icebreaker. I love icebreakers. Use a non-scientific thesaurus. Find books to share. And I actually do have a slide, so you'll get my slides with science versus non-science, and this is how we communicate. So using our words carefully and cleverly, and it's non-condescending. Ask something about the people, but not too personal. Don't ask me all my personal business. You don't need to know all my stuff, but ask me something that's relative to me. Share something in common. Study your audience in advance. Be prepared to go off your agenda. Listen to yourself talk. That is so important. If you think you're rambling, you are rambling. If you think what people are, you're talking so people can't understand you, or people cannot understand what you're saying, that's probably true. Listen to yourself talk. Be willing to be wrong and change course, or be willing to be in a place where you just need to change course. I change course all the time in conversations and presentations, especially in the community, when I notice that, again, they're not understanding, or they're not listening, or it's not relevant to them, and I change course. You have to do that. Accept life in the moment. Be willing to return and learn more. Always leave your audience with the understanding that, hey, guys, if you need me, I'll be back. Guys, I want to come back. I want to do more. I'd like this to be the first and not to last. This is a wonderful start for us. Where do we go from here? I heard a lot of good things today. How can I be of assistance in the future? Right? Those are things that we really want to make sure we're doing with our participants and our community. I'm going to stop here because it is time, but I'm not out of slides. I'm not out of work. So I can certainly share more, but I want to hear if there are any questions or any thoughts. I'm going to stop here. All right.
I just want to thank you for a wonderful presentation, and this is great information and really beneficial. I just want to thank you for that. And
Oh,
I'm Mary Elizabeth, by the way. My name's somewhere on my screen. I don't know where it is, but
thank you, Mary Elizabeth.
Thank
Thank you. Thank you all.
Hi, Gina. Diane Wilkinson from the RAP study. Thanks for your talk today. I'm keeping all this in mind because the RAP study is doing its information sessions with participants very soon. I was thinking about your remark about sitting amongst the people. And on the one, I see the pro of that, that the ability to talk, to meet, to actually meet people, mingle. But I'm wondering if there might be an inhibiting effect if I'm sitting with people who may want to talk among themselves and not necessarily favorably about study participation, and I'm inhibiting their conversation. Yeah, so I do have that reservation sometimes about small groups. Can you talk about that a little bit?
Absolutely. Hey, Diane, thank you so
Hi.
much for coming, and thank you for your question.
My pleasure.
Absolutely. And here's the way I think about that, Diane. So ask permission to sit at the table. Hi, I'm Diane. I'm with the testing. I'm a tester. I'm not here to talk about anything. Is it okay if I sit at the table and join you guys? And it's okay if you feel uncomfortable. With me not being here. I'm happy not to sit here, but if you don't mind, I'd love to. And what I think you'll find, Diane, is that they'll welcome you. And part of that is oftentimes people want to share, feedback with you guys, good, bad, or whatever. And they also oftentimes want to ask questions. So I think even at those info sessions, it's an opportunity for you to learn what is working. And I know you really are very, very sensitive to making sure participants have the best experience possible. And you may find also that they'll want to know, well, tell me more about what you do and how can you help? So I think it could be a win-win, Diane. But I think again, the best thing to do for me is I often just ask permission.
Gina, I had a question. We deal with a lot of study teams, and I've been in this spot too where you don't really have time to get to know the prospective participant. Maybe you're in a busy clinic situation, and they sort of immediately decline before you get a chance to say anything else about the study or to use all of your verbal communication techniques. I'm wondering what you would say, what advice you have for folks who are in that situation.
That's another excellent question. And I think that's a tricky place too. Part of what we do and part of what we can do, I think there are opportunities through verbal communication. So for example, with the way the study is set up, you're consistently walking through, we have times where we're walking folks to cafeterias, we're walking folks to different places. And I think sometimes just having a lay conversation about other work that happens in the research is a way to introduce. It doesn't mean that you're asking them or inviting them to participate, but it is a way of engaging people so that they know, by the way, do you know we do other studies? Or do you know there's other studies that are being done? And you're not asking them to work or to participate, but you are informing them. That's one way, especially if you're trying to build rapport with people throughout the study visit, right? There are also opportunities through our written communication, right? When we're thanking people. One of the things that I've come to grips with is that asking people to participate in another study while they're busy doing a study can be complicated. But we do these emails to people, and we can be saying to people, instead of saying, hey, here's another study, it certainly could be a, hey, how you doing today? This is information. I know we talked at the visit. I wanted to follow up, and here's some little bit about this. Here's some more about this. I'll give a really good example if people have a moment. So, and this is a personal story, just so you know. So my mother-in-law was a donor. She was, people, you know, we talk about donors. I talk to donors, organ donors, I should say. And my family was like, nope, we're not going to let her be an organ donor because they're going to take her early. Whenever something happens, they're going to take her early. Well, long story short, she went ahead, she did it. She donated her body. You know, she did all the stuff she needed to do. Long story short, she ended up having a stroke. She was on life support, and her sons were, we don't want her to donate. We're not going to take her off life support. Well, the hospital was mindful of their wishes. Now, did it change anything about her willingly being an organ donor? No. And when she passed, did she actually donate her body as an anatomical donation? Yes. But what that did is that it gave them a new perspective of organ donation, right? It actually helped them to see that, oh, we were thinking wrong. We were not thinking like that. So what's the point of that story? Is that oftentimes time and context make a difference. It may not work in that first visit, but it may work over time. That's the other thing we have to remember. These are longitudinal studies. We do have the luxury, I would say, of time. I may not get it on the first visit, but I may get it on the second or third visit. I may get it at a point where I'm coming back to hear more. I may see it in a newsletter and be inquisitive. So sometimes all we're doing is planting seeds, and we kind of have to be mindful and accepting of that. Does that answer your question, Ann? So I hope you guys got something out of this. I've got, again, totally always more slides, but I think we had a great time. And if ever there's more that you might need, let me know. Thank you guys so much.